everyone has doubts regarding hemoptysis. So hemoptysis is coughing out of blood. If the patient is having hemoptysis, it does not mean like it is a malignancy, lung cancer, what we call as. So not all the lung cancers will have hemoptysis. There are so many other reasons for the causes of hemoptysis. They are pneumonia, chronic bronchitis, bronchiectasis, necrotizing pneumonia, and pulmonary thromboembolism, and vasculitic conditions. So the treatment basically depends upon the severity of the hemoptysis. That is, it is categorized as mild, moderate and severe. If the hemoptysis is severe, it is a life-threatening. So definitely we have to intervene the patient, and the patient should get admitted immediately and treat accordingly.